Hello, this is Steve Webster. This is another update. Today is April 20th, and we've got some good news with this pandemic with COVID-19, where it looks like at the federal level, they're starting to ask the governors to consider trying to reopen the economy. Kind of reminds me of government shutdown. When a government is shut down, it's not really shut down 100%. It's partial shutdown. So the economy has been partially shut down. Mostly gatherings like restaurants have been really hit, and some other non-essential businesses. Some of the supply chain has been hit. If you're not related to essentials like grocery chain supply, like wood, you know, wood floors or carpeting, they've been hit hard. So we're glad to see that uh, there's a plan to bring it back the economy because the hardships from economy hardships are very impactful in many ways, and which I don't want to get into. But here's the update for today. Today is April 20th, which is this column. According to Johns Hopkins charting and website information, Florida has these many cases. If I estimate an additional 50%, which was discussed in previous videos, it's that. Regardless, we see a good sign here, don't we? We see the rate was very high on 323. It went down on 330. It went down tremendously, a big drop, a huge drop on April 6th. On April 13th, it dropped again, and it dropped again on 420. So definitely coming down from the curve. And as a reminder, as a positive spin out of the total residents in Florida, which is about 22 million, 99.8% of us have not acquired this COVID 19, which is good. The hospitalizations, I'm going to whine about that again. There's just no data that is being reported daily of what the hospitalization resources are: beds, ventilators, masks, gowns, people. They're just not sharing it. It's just terrible. How can decision makers at the local, city government, county level make decisions if you don't have the data to make those decisions? So, as a recap, we should ignore positive cases. It doesn't matter if it's 2 billion positive cases. The problem we're trying to solve is not to max out hospital resources and reduce deaths. Ignore this. Focus on hopefully actual hospitalizations instead of this silly accumulated one that we really don't know. But even in the worst case, the percentage of use in the worst case is still fine. Looks like Florida's never had a problem. At the county level, I found some information, 326 here. We don't really, this is old, this is a couple days ago, so it's not current. But even then, we see a drop in here as well. So that's all good news. So what I'm planning to do is prepare a more thought-provoking slide deck presentation for the local governments, like here in Lakeland, at the county level, state level, maybe national, depending on the representatives for this area. I guess some of those things would be helping people, decision makers, to say, don't be distracted by numbers like number of positive cases. It doesn't matter because we're supposed to be focused, tunnel vision on hospitalization and reducing deaths. And so I'm going to help to prepare folks to say, focus on what matters. Don't be distracted over here. Okay. Another objective will be how to manage day by day. For example, if you look at the weather, you have tornado warnings, severe storm warnings. Well, did you know there's also like an ozone warning, which means if there's too much ozone, like pollution has caused or whatever's going on in our local weather, there will be an advisory to say, oh, if you have asthma, stay indoors. If you're planning to run, don't run today. The ozone's bad, pollution's bad. So similarly, I'm thinking that COVID-19 could have something just like that, where each day we could instruct the community, like Lakeland and Polk County and the state of Florida, to say, check the COVID-19 weather report, per se, or in this case, virus report. Are there any hotspots in your area that you should say, whoa, maybe I shouldn't go to work. I should work remotely. I should shelter in place. I should not go to the grocery store. Could be exposure in this area. I should maybe delay that another couple of days. And then the next day, there may not be a COVID-19 problem, go back to normal. So on a daily basis, we should have that type of perspective. And another point I would like to put in that presentation is a very giving, loving thing. And that is, out of the couple tests that are out there, the one that I'm most excited about is the COVID-19 antibody test, which tells a person if you've had the COVID-19, in let's say in the last 45 days, you may not know that you had it. But if you do have it, you have an opportunity to save a life, or perhaps reduce the suffering and get someone out of the hospital quicker. Because the idea is if you've been positive with COVID 19 in the last 45 days, you're healed, you have antibodies. Take that plasma out and transfuse it into a patient who needs it, you save a life. So, those are the type of things I'm going to put in that formal slide deck presentation. And so I'm basing this on I've gone through a global crisis before with Y2K in the IT field. I've learned a lot from that, and and that sort of thing, and how people do overreact and how they get sidetracked on other things that they shouldn't be looking at, but look at what matters. So I'm going to try to share that with my experience and knowledge. Thank you.